Okay, let's talk about now what the flow of the day look like. The day you're gonna get your chemotherapy. Big day, right? So it varies based on center to center and where you got your labs and treatment, and if you're seeing your doctor or not. But just let me walk you through a sample or a typical day, and of course it will be customized for you based on what you're getting. Okay, so you drive to the center with your family and then you check in at the cancer center, and usually they'll ask you for your photo ID. They might ask you for your insurance card if it's not been pre-approved. They might give you a token number and they will register you for your blood draw if your blood draw has not already been done. So then you'll be called in for your lab draw. Lab draw is basically your blood draw. So here the nurse will start IV for you, which is like a catheter for giving you your fluids and drawing blood. If you already have a central line or a peripheral line catheter, like a PICC line or port, then she might access that and draw labs. If you already have labs drawn, then we can skip this step. Okay, so she'll start IV, draw blood, and then you will come out from there, and usually there is a 30-minute to 1 hour time frame while your labs are being processed and the results come out. So if you're seeing your doctor, then you go to the clinic for doctor's appointment, and here you check in and then you wait until your lab results are back and until your oncologist can see you. Sometimes they might take your vital signs here, which means they might get your blood pressure, your heart rate, your respiration, your weight, height, and things like that. Okay, so basic check about how you're doing. And then you will see your oncologist or your nurse practitioner or physician assistant, and the practitioner will go over your lab values to see if you're doing okay. Also, they will do an assessment, and now is a good time to ask your questions and any concerns that you or your family member might have. And now, based on all of these, to decide if you're going to be getting your treatment or not. So if you're going to get your treatment, yes or no, and if yes, then what that treatment is going to be. They might adjust the dose. So if you're supposed to get your treatment same day, then you will go to the infusion center, where you might be getting the treatment, and you check in here, and you might end up waiting. Okay, and then you get called in for your appointment. So now here, if your vital signs have not been taken yet, then your vital signs might be taken, and you might be taken to a chair or a bed or a room based on the center, whatever is the facility. And there is a nurse. It was usually a chemotherapy certified nurse who is assigned to you, and she's usually taking care of multiple patients. So the nurse will review your order, your doctor's order, to make sure that it's signed properly and it looks good, and she's going to use her clinical assessment to make sure that the type of cancer you have, it is matching with the treatment that you're supposed to receive and how often, and that your lab values look okay for you to be getting those treatment. Okay, and then she might come and say hi to you, and she will do her independent assessment to make sure that she thinks that you are healthy and all your health issues have been addressed. She might help you answer any questions, and she will do education for you. So if this is the first time you're getting chemotherapy, she will teach you about your chemotherapy, signs and symptoms, what to expect, what to manage. And now, based on her assessment, and she will look at your weight to determine if the chemotherapy is appropriate for you. So then she can inform the pharmacy to start making your chemotherapy. Okay, and then in the meantime, she might bring you the IV fluid, so that's like normal saline or D5, which is sugar water. So based on the type of chemotherapy you're getting, this is the fluids that go along with it. And also she might give you your pre-medications. So pre-medications are medications that are given with the chemotherapy to decrease the chances of side effects and for your chemotherapy to have better impact. Okay, and then once you have got your pre-medications and your chemotherapy is ready, it's verified usually by another RN, and the pharmacy usually has verified your order to make sure that it looks good, and then you get your first chemotherapy. And usually the nurse will monitor you to make sure that you are doing well and you're handling the chemotherapy well. If you are experiencing anything uncomfortable or you have questions, you can ask. Sometimes she might use this time to do more detailed assessment or education, or answer your questions. And also now might be a good time to discuss home medications if you're supposed to be getting any home medications. So she might bring that up. And if you're supposed to get some home prescriptions that are not filled, then she might ask your family member to go fill home prescription at the pharmacy if it's at the hospital itself. Otherwise, she might give you the home prescription order so you can get it at home. And then you continue with getting your second chemotherapy if you're supposed to get multiple medications in your regimen. So you get all of those, and when you are done, then you get some more IV fluids until you have got all the chemotherapy treatment in you. And then your peripheral IV might be disconnected, or if you're getting a port or a pick, then those might be cleaned and ready for you to go home. And then you can check at that time if you have itinerary, which means you know when your next appointment is, when you're supposed to come back, and if you know who to call when you have questions and where to go. And when all that's done and you're ready, then you can check out and walk to your car and go home, and it's all done. Okay.